amazing few days. Yeah, it's been incredible, hasn't it? When you just think about the breadth, of topics and opportunities, everything from team-based care, improving access, learning from Indigenous worldviews, safety and human factors, learning from lived experience. Oh my goodness. And, wherever I go in the world, I don't think anybody does this better than BC. So, what an amazing... Yeah, what an amazing opportunity. So, now is where the rubber hits the road, okay? Because we've had, this brilliant opportunity, okay, and brilliant experience, and now it's up to us, okay? So the theme of my talk this afternoon, my final plenary, is about, what are we going to do, okay? How are we going to make a difference? And particularly, in order to do this, we need to take the power, okay, for change. Now, those of you who did the quiz earlier know that this is the 4th time that I've done a plenary at the Quality Forum. And the thing about that is, my message hasn't really changed. So, okay, it's kind of got a bit more nuanced, and I've learned a few things, but the message is basically the same. So, yeah, you might see 1 or 2 slides that you saw in 2015, okay? And I'm doing that on purpose. But let's talk about action that we can take. So, what I want to suggest, okay, is that there are potentially 4 different areas of action, okay, to explore, okay? It's up to us. How can we take action? So the first one I want to talk about is about how we build our agency or power for change. Secondly, we have a slight animal theme. I want to talk about influencing and super connecting, and here we are going to talk about tortoises and horses. Thirdly, the theme or area for action is about shaping networks, not opinions. And the final theme is about action based on learning, and there we might meet some mice and some horses. So, we're saying, taking the power to change. What do we mean by power? Well, here we have got the father of modern logic, Bertrand Russell, and he describes power as the ability to achieve intended effects. And what we mean by that, all of us as change makers, as improvement leaders, if we want to make change happen, if we want to implement some of the great things that we've learned over the last few days, then we have to take power. I'm going to show you a slide now that I actually showed at the forum in 2015. So when we think about power, it's very helpful to think about at least 2 different kinds of power, okay? Old power and new power. So a quick reminder for those of you that were here in 2015. Old power is like currency, it's like money. A few people with formal authority, okay, have got a lot, but most people haven't. So it's held by a few people. And the thing about old power, it's pushed down in organisations and systems. We can command people to do things if we're senior leaders. You've got to do that because it's the quality standard. You've got to do that because we've got to balance the books financially by the end of May. And it's closed. So if I'm the chief exec of a hospital system and I'm working with the local community, I can't command them to do anything. And largely, old power is transactional. It's about structures and systems and processes and holding people to account and governance mechanisms. Let's contrast that with new power. New power is like a current. It's a surge of energy that happens when many people with the same purpose and the same values come together. Okay? So it's made by many. We can pull it into our organisations and systems. It's shared, it's open. Anybody that agrees with or wants to be part of our New Power campaign or movement is welcome to be part of it. And New Power is relational. One of the big differences between New Power and Old Power is people will engage in a New Power way because they want to, because it fits in with what they want to see happening in the world. Whereas with Old Power, we have to do things because it's our job, okay? It's how our jobs are set out to do. And as change makers, okay, we have to work with both. We have to operate in that very difficult zigzaggy place in the middle. And very often people will say, I can't make change happen. I haven't got any power. Okay, I'm only a trainee. I'm only a student. I'm only a staff nurse. I'm only a middle manager. But the reality is, all of us have got a really, really significant potential for power for change. We just need to take it. One of the people that influences my change practice a lot is Greg Sattle. And here's some of the wise things that he says. Okay? He says, one of the things that we know from the earliest studies of innovation is that in terms of how innovation spread, change always comes from the outside. Okay? So again, we need to be linking up with other people. And he says, change isn't top-down, nor is it bottom-up. Okay? It emanates from the center of networks. And he says, ironically, the way that you get to the center, okay, of networks is by connecting out to small groups, loosely connected, and uniting them with a shared purpose. And when I think about my many decades of practice as a leader of change, I just see this time and time again, okay? That change is a side-by-side process, not a top-down, not a bottom-up process. And it's about these small groups coming together, loosely connected, united by shared purpose. Okay? Here's another one you might have seen before. This is some research that was undertaken by two Canadian researchers, Batalana and Casciaro. And their research was to go around 67 hospital systems in the National Health Service in England. And what they wanted to understand was what makes an effective change agent, what makes somebody that can lead change. And what they found, okay, was that somebody who is at the center of an informal network, okay, has got far more power and ability to make change happen than somebody who is at the top of a hierarchy. So again, it's up to us. If we want to make change happen, if we're inspired by this forum, okay, it's where we need to be. Essentially, what we need to be doing is building agency. And that word agency, what does it mean? It means I feel that I have got the power and ability to make choices and act on them. I feel that I don't need permission. I feel I've got the control, the autonomy to get on and do it. And there's multiple kinds of agency. There's individual agency, which is about people getting more power and control in their own lives. I mean, obviously, that's something that we want for people that use our services, for our patients. We want people to feel a strong sense of agency about their own health. We want people that work in our system at the point of care to feel a strong sense of agency around their ability to improve services. And, okay, the most powerful kind of agency is collective agency, where people will act together, okay, who are united by a common purpose, harnessing the power and the influence of the group and building mutual trust. And again, when you think back to what we said about New Power, okay, it's based on relationships, it's based on trust. I do love a good model, and George Box, a statistician, said that all models are wrong and some are useful. Here's a useful one. This comes from Gary Hamel and Meshali Zanini, and in 2020, they wrote one of the best-selling leadership books of that year, and it was called Humanocracy: creating organisations as amazing as the people inside them. And in this book, they talked about a hierarchy of capabilities, okay? And what they basically said is, in organisations, the further that people can go up this pyramid, okay, the more we can humanise our organisation and maximise the contribution that everybody can make. So if we start at the bottom, okay, what we see there is obedience. Okay? So as leaders, we can expect people to be obedient. You know, we can expect people to follow the rules, to adhere to the policies. We can expect people to be diligent. We can expect people to turn up when they're meant to and to do a reasonable day's work. And we can also expect people to have expertise. Either people come with expertise to the job or they're willing to develop their expertise. So these capabilities at the bottom half of the pyramid are qualities that as leaders we can expect and we can command people to do. But as we get higher up, it changes. Okay? So the next one is initiative. We want people in our organisations and systems to feel that, you know, they've got the initiative, they can make change happen, they can get on with it. We want creativity. We know that our systems need to change radically, so we want new ideas. And then at the very top, we have daring. We want people to have the sense of courage, okay, to be willing to try new things, to take risks. And the thing about these capabilities at the top half of this triangle, they're all qualities that as leaders we cannot command, okay? Unless people feel that they want to, okay, they're not going to do it. And again, it's interesting to think about this in the context of the pandemic, because during the pandemic, so many people were operating at the top half of that pyramid because we had to come up with solutions, we had to find new ways of doing things. And then, you know, after the pandemic, we kind of went back down to the bottom half again. But this is all about agency, and this is why, you know, very often thought leaders will say agency is the greatest capability of all. Because if we don't feel we have agency, if we don't feel that we have you know, the power and ability to make things happen, we're not going to work at the top half of that pyramid. And at the moment, in the Canadian system, in the UK system, we're talking greatly about productivity. But we won't solve the productivity challenge in the bottom half, okay, of that pyramid. You know, we won't make people more productive by making them work harder, okay, or coming up with better systems. Okay, we will gain our productivity by supporting people to build their agency so that they feel a sense of control of their work and their well-being, and will find better ways of doing things. So, how do we build agency? Okay, here's some ideas. I really like this triangle, and I mainly put this in because I just like this word, agentic, you know? And it's like we want to strive to be agentic because it's the most important capability that we can have. So when you go back home and people say, what did you learn at the BC Quality Forum? You said, oh, I learned to be agentic. But, you know, so much of our ability to build power is about relationships, okay? And so cultivating authentic and sincere relationships with our colleagues, with our peers, with other people that are important for making change happen. Secondly, start with a majority. You know, you don't have to be like a majority of the whole team or the whole department or the whole organisation, okay? 2 people can be a majority. Find people who are as enthusiastic as you are, who are willing to support your idea and to strengthen it. Okay. Number 3 is about actively pursue diversity in your network. I mean, we saw from Jay yesterday about, you know, how polarized people become, and we stick with and we learn from people like us. And the more that we bring other people into our networks with different views, then what will happen is we'll get new perspectives, we'll get new ideas, and we'll spread ideas further. The next one, okay, number 4, work with and don't diss the formal system. Okay? If you look at people in organisations who are the best disruptors, they're not the people that are like shouting out and running around the organisation like an unguided missile, trying to make disruption happen. The people that are the best disruptors are the people who have built the ability to disrupt through relationships. Okay? They're the people that have got the strong connections. Okay? If we want to disrupt, build relationships and work through the system. Number 5, create small changes. We consistently underestimate the power of small changes. Just even a change that makes a difference to 3 of our colleagues or 2 patients, it shifts it from being a concept or an idea to something that's happening. It gives us a sense of hope and possibility, and it gives us social proof. And number 6, and we'll come back to this, always, always follow up, because the best ways to build agency are to build collective agency, and it's relational and people are trusting us, and we must always follow up. So just going to show you a little bit of data, and this comes from an evaluation that my university, Warwick Business School, a team did around a big experiment in the NHS. And what happened was the NHS in England brought over to England the Virginia Mason Institute. Virginia Mason is a healthcare system in the USA that does whole organisation, whole system improvement based on lean principles. And in England, 5 hospital systems were chosen, okay, to implement the Virginia Mason lean improvement approach for 5 years. And the evaluators, followed all the hospital systems beyond that. It was really interesting. Okay, all 5 of these hospital systems got the same resources. They all got support from Virginia Mason. They all got finances to implement changes, and they were all in a learning set together. So they all got exactly the same inputs. However, at the end of 5 years, okay, 3 of the hospital systems had improved their performance and moved forwards, and 2 of them had actually gone backwards. Okay, after 5 years of Virginia Mason, their performance had gone backwards. And what the evaluators wanted to understand was what made the difference between the 3 that moved forward and the 2 that went backwards. And they only found one significant difference. And that was the level of social connection between the people that were leading the improvements. And I'll show you some pictures of this. So these were 2 of the hospital systems that were in the experiment. And the first, system A there, can you see the network there? It's a distributed network, so there's lots of people engaged, learning and sharing and talking to each other. If you compare that to System D, okay, post Virginia Mason, System D went into special measures. I don't know if you have this in Canada, but basically what it means is the regulator comes in and does an inspection and says, I have no confidence, okay, in this organisation. And then other leaders in a consultancy, like McKinsey or KPMG, are brought in to prop up the leadership. Nobody wants to go in special measures. Okay, but can you just see how different it looks? Like 2/3 of the network is decentralised. There's not a sense of distributed leadership. It's chain-like. And again, what we know about that in terms of organisational network analysis is that is showing a much lower capacity to facilitate knowledge exchange and learning. So, the only difference, okay, significant difference, was about levels of connectivity. And how we might explain that is to say, when you've got an organisation built on strong relationships, distributed leadership, lots of learning and sharing going on, you've built the readiness, if you like, the relational conditions, okay, for change to happen. So you can almost plug in your improvement method on top of that. But where you haven't got that, you're trying to build improvement on sand. So let's not underestimate the power of relationships. Okay, let's talk about number 2, which is super connecting. And again, let's carry on with this theme of network analysis. This data comes from a Danish organisation called Innovisor. And Innovisor has gone into hundreds of different organisations in multiple sectors. And what it shows time and time again is that in most organisations, there's about 3% of people, and they drive the conversations with 85% of other people. So a small number of highly influential people, again, we talked before about at the centre of networks, who were able to drive these conversations right across the organisation, like hugely influential people. So, why is it important? I mean, we call them super connectors, or the 3%, because there's many reasons why large-scale change fails, but a major cause is poor dialogue with the influencers in the informal organisation. Because these 3% are people, they've already got the relationships in the system, they've already got the networks, they understand the context. Okay? Whenever anything's going to change in the organisation, other people go to these super connectors and ask them to make sense of things and reduce ambiguity. So, they make meaning for other people. Typically, these super connectors are trusted by their peers more than formal leaders are trusted. They're often unknown to the formal leaders because the formal leaders haven't engaged with the informal organisation. Another thing that's interesting about these people is they're typically not the innovators that are starting new change. Okay? But if you've got something that you've tried out, like piloted in a few areas, and you want to spread it across the whole organisation, these are the people who will either accelerate the change or they'll block things if you're trying to do them at scale. So how do you find your super connectors? Well, you can bring in an organisation like Innovisor and do organisational network analysis, or you can ask about 10 people. And once you've asked about 10 people, you can usually work it out. And the kind of questions we'd ask is, who do you go to for information when you've got concerns at work? Or whose advice do you trust and respect? And usually you'll find out. So, what does that mean for me? I'm sat here, I'm thinking about changes that I want to make. Well, first of all, if you're trying to make a big change happen in your organisation, find your 3%. Okay, get their insights, find out what they think, try and engage them in the change. And because this is so relational and long-term, stay connected with them for the long haul. And then the second thing I'd say is learn from them. And as change leaders, we need to be connectors. We need to be building our own networks and making connections with people across the organisation about change that we're passionate about. Okay? So much of this is about trust and positive behaviour. So as leaders of improvement, as change makers, we need to be the role models. And again, we need to always, always follow up. Okay? Because if we don't follow up, people won't trust us. And this is where we come to animals. So this is a variation on a Dutch proverb. And it says, trust arrives on a tortoise. Because, to build trust, okay, it's step by step, over a period of time. But what we may find is that, we do something, okay, we take an action or we say something that takes trust away. And it goes away very quickly. It leaves on a horse, okay? So we don't want to be doing that, okay? Number 3, okay? Don't try and shape opinions, shape networks. Here's a quote from Eric Hoffer, and he says, when human beings are free to choose anything they want, they typically copy their neighbours, okay? And we heard this yesterday from Jay, about the power of reinforcing echo chambers. And we're back to Greg Sattel again, and he says, people typically do not change their opinion as a result of effective communication. We get told, if you want to communicate change, communicate it 6 different times. I think that's rubbish. Because the thing is, communication isn't change. You know, communication is communication, and you can show people all the data in the world, but they'll be much more influenced by peers than they will by data. Obviously, if you've got some data and you've got a peer that loves the data, then I think that's great. And again, you know, the best indicator of what people do and think is what people around them do and think. And he says, working to shape opinions is fruitless unless we are able to shape the networks in which ideas and attitudes and behaviours form. So we have got to get so much better, okay, at understanding, you know, social relations, social connections, and work peer to peer. So, you know, we're saying that relationships are so important. If we've got a change that we want to make happen, how do we create the relational conditions for action? Okay, that's been a theme in my talk. You know, when we looked at the Virginia Mason work, okay, System A had created the relational conditions for action. So, you know, whatever our topic is, whether we're talking about supporting people to older people to thrive at home, or we're talking about supporting young people you know, who need access to mental health services, or whatever other topic, okay, how do we build an ecosystem for change? So we need to have different voices in our system. The first voice, or set of voices that we need to have, is the voice of intent, okay? We need people with old power. We need people with the authority or mandate to be able to drive the change. They need to be in our system. Secondly, as part of the voice of intent, we need people with the passion or motivation to want to take action. Our second voice is, of course, the voice of experience. And again, we need to be engaging people with lived experience and the context of the issue right from the beginning. And we also want to involve people who will be users of or affected by the changes that we make. The third voice is the voice of capability. People with resources to contribute, okay? People with money, with people power, and also people with specialist knowledge, skills and tools that we need to be part of this. And finally, we have the group that are really important, but that we forget constantly, and that is the voice of connection. We need people who can broker and facilitate or coordinate, and people who can connect across diverse communities. So the question is, how do we connect people who want to do something with people who can help and support them, while staying grounded in real world need and experience to ensure it works? So now, like any change project or improvement project that I'm working on, I'll do this analysis with people, okay? You know, just to make sure we're involving people right from the beginning. And another thing that I would say about this is, you know, more and more, I think people are starting to understand that just how important relational conditions are. And we're working in a world where things are very unclear, there's a lot of ambiguity and a lot of certainty, okay? So we can't be sure exactly what the goal or the aim is. We can't, when we start, even know what the roadmap is. But what we're doing here is we're creating the conditions for those things to emerge. And increasingly, people are saying, you know, thought leaders, leaders in this area are saying, we're getting to a stage now where we need to think about relationships and building the right relationships as an outcome in their own right. And here's a quote from Bill Bonnier, who developed this approach. And he says, "Value is created and breakthroughs are made through the strength, number, and quality of relationships in these systems. Exactly what the relationships will produce isn't determined. We can't know because we don't understand cause and effect. But, okay, what these relationships will do is create the system conditions that will allow the right things to emerge." So there's big implications for us here in terms of our role as change makers and improvement leaders, okay? Because very often, you know, we end up in the role of being a program manager, and program managers are great, okay? But what do? Typically, they design a program plan. They have got accountability within a governance system. They ensure that delivery milestones are met. They'll communicate progress, and they'll deal with risks and ensure that barriers are overcome. And those are all really important roles, particularly in an old power world. And we need to be conveners. We need to be the people that bring that ecosystem for change together. You know, we need to be the people that are building community, making sure that all the voices are there, that are boosting commitment to a collective goal or collective direction. Okay, that are enabling trusting relationships. Okay, you know, tortoises, not horses. Seeking win-wins. Okay, you know, when we're conveners, we're not trying to find winners and losers. We're trying to come together with shared purpose and create a win for everyone. Okay, conveners make sense of things for community members, like the why. You know, why are we doing this? Okay, the bigger purpose, and they help spread learning across a whole system. Okay, we need to be those people. Final topic, learning. Okay, and again, we have this animal theme about mice, not horses. Okay, I'm going to show you a kind of metaphor now, and what I'd say about this, when I think about the organisations in the National Health Service in England that are really the best systematic improvers, they do this thing I'm going to show you now. Okay, they create Trojan mice. Okay, and when we create Trojan mice, we have many people across the system who have got both the capability, the improvement skills, and the sense of agency to test out small, well-focused changes to address complex problems. And they nearly always work better than Trojan horses, which are large pilot and rollout projects. And this is Harold Jarchi, he's from Canada, and he says, Trojan mice are small, well-focused changes which are introduced on an ongoing basis in an inconspicuous way. They're small enough to be understood and owned by all concerned, but their effects can be far-reaching. And he says, and I believe this, collectively a few Trojan mice will change more than one Trojan horse ever could. And very often our organisations, our healthcare organisations, will go along the first phase of this in the sense that they'll invest in a lot of improvement capability, which is fantastic. But then we don't go to the second stage, which is to get everybody joined up, you know, like an army of Trojan mice. And that's where we need to be. We need to be Trojan mice. And the great thing, or the most powerful thing about Trojan mice is that, you know, we've got all these people across the organisation who can try things out, and are they going to work or not? And we end up experimenting, failing and learning, and all those things are fine, okay, right at the beginning of the process. Whereas if we do Trojan horses and we're doing a big you know, pilot project, very often we don't get the results until it's too late. So those of us that are in leadership roles, okay, what should we be doing to be building a learning culture through Trojan mice? So 4 things I think we should be doing. First of all, we should, as leaders, be role modelling a high tolerance for failure through practical experiments. We're creating a culture that it's fine to fail early. And Amy Edmondson's recent book on intelligent failure, okay, is really great, really practical, and it's all about that. Secondly, we need to demonstrate that experimentation, trying things out and learning is a core part of everyone's role. And I put the kind of classic improvement quote here from Paul Bertolden and Frank Davidoff. In healthcare, everyone has 2 jobs, to do your work and to improve it. Okay? So like this work is core work. Thirdly, again, that issue about follow-up, it's so important. Make sure that the work of Trojan mice teams is followed up organisationally so that the teams that are doing this work can see a people-centred benefit to the work they're undertaking. Okay? That we have to show that this work is valuable and meaningful. And finally, when you work in this way, there's this really, really big tension at the heart of it, right? Which is, when you think about the values of innovation, okay, which are about openness, diversity, experimentation, play, okay, they are fundamentally different to the values of productivity, like excellence, precision, standardization, and delivery, okay? And what you're asking your Trojan mice to do is to be part of the delivery system of the organization, so the operational delivery system, and to be innovators, okay? It's really, really tough gig. So what we've got to do as leaders is to support our Trojan mice to be supported to exist in both worlds simultaneously. Right, the title of this talk, okay, is It's Up to Us. So I just want to give you a couple of minutes to just kind of think about this, okay? What we know is that small actions can spark really big change. You know, when I talked before about building agency, I said, you know, don't underestimate the power of small change, the social proof that it gives people. Who works with liberating structures? Who knows about liberating structures? Lots of us, great. So liberating structures is a set of facilitation approaches. They're really powerful that anybody that is doing change or wants to do change can do. So you don't need to be an expert facilitator. You can just take these ideas. And one of these liberating structures, these ideas for facilitating change, is called a 15% solution. And what that means is that if you look at all the things that you could possibly do or possibly change, there's typically about 15% of it, which is something that you can do without any approval or resources from others or permission, things that you already have the agency to do. And it's something that you can start doing right now if you want to. So I'm going to give you 2 minutes, okay? Have a chat with other people on your table. What is your 15% solution, okay? What action can you take away from the forum that you already have got the agency or power to take? So base it on something that's inspired you at the forum. Talk to the people around you about it. Take a photo of it and put it on your postcard if you'd like to. So 2 minutes, okay? What is your 15% solution? What have you been inspired by at the forum that you could just take away and do now? So over to you. Hi everyone. Hi. Should we just come back together? So, yeah, thank you. So the theme, okay, the theme of my talk was it's up to us, okay, about, you know, taking the power for change. And, you know, as we leave the forum now, we all have so much power to make a difference. You know, collectively, we can do so much. Okay, we just need to take our power, and we need to support our colleagues, other people, to take their power too. And I just wanted to end with a quote from Peter Block, and he says, "Confronting people with their freedom may be the ultimate act of love." So every one of us, okay, has got a huge amount of untapped potential and agency to make a difference. And every one of us can go back from this forum. And, you know, it isn't just about ourselves, it's about people in our teams, okay? So we may go back feeling more energized and braver and more determined. And you know, we all know it's so tough out there for our colleagues at the moment. So if we can go back and we can talk with our colleagues and collectively with our colleagues build our agency, then you know, that may be the ultimate act of love. And, you know, some of you are wearing love badges, and some people don't like the word love, but, you know, interpret that however you want, okay? But, you know, for me, you know, when we talk about love, it's about the, you know, the ultimate thing that we can do to make a difference in the system. You know, the reasons why we're here, why we do the jobs that we do. So actually, you know, in a sense, confronting each other with our ability to make a difference, our sense of agency, may be the most important love-based thing that we do. So just to say finally, change makers and improvement leaders of British Columbia, Now is your time. So let's do it.